Bismillahirrahmanirrahim. This video is about the diseases of nasal septum. In part 1 of this video, I am going to tell you about the key clinical features which are going to help you in identifying different diseases of the nasal septum, and then we will discuss the deviated nasal septum in detail. So let's get started. Deviated nasal septum or DNS is the most common disease of the nasal septum. Other diseases include septal hematoma, septal abscess and septal perforation, which will be discussed in the part 2 of the video inshallah. Now the key points which are going to help you in identification of the diagnosis of the diseases of the nasal septum. Number 1, history of trauma to the face or nose. Trauma and errors of development form the two most important factors in the causation of DNS. Number 2, nasal obstruction. If there is unilateral nasal obstruction, it indicates DNS or deviated nasal septum, while if the nasal obstruction is bilateral, it indicates septal hematoma or septal abscess. Next, the epistaxis, headache and turbinates hypertrophy are the three features indicative of deviated nasal septum. Bilateral swelling of the nasal septum and fever are the features indicative of septal abscess. Now a quick recap. Unilateral nasal obstruction indicates deviated nasal septum, while bilateral septal swelling indicates septal hematoma or septal abscess. If there is high-grade fever, it is indicative of secondary infection of septal hematoma, which presents as septal abscess. Let's discuss the deviated nasal septum in detail. First of all, the causes of deviated nasal septum. As discussed earlier, trauma to the nose is the most important cause of DNS. Injuries to the nose commonly occur in childhood but are often overlooked. Trauma may also be inflicted at birth during difficult labor when nose is pressed during its passage through the birth canal. So, trauma is the most important cause of DNS. Other causes include developmental errors, racial factors and hereditary factors. For memorizing the clinical features of deviated nasal septum, we have a mnemonic which is NASHEEM has DNS, in which N is for nasal obstruction, A is for anosmia or loss of smell, S for sinusitis, H for headache, E for epistaxis or nosebleed, while the second E is for external nasal deformity and M is for middle ear infection. The most common presenting complaint of the patient with DNS is chronic nasal obstruction or nasal congestion, while the rhinosinusitis or recurrent or repeated sinus infection can also be the presenting complaint of a patient with DNS. Let's talk about the types of DNS. There are 5 types of DNS. Anterior septal dislocation, C-shaped deformity, S-shaped deformity, septal spur and septal thickening, which will be discussed one by one. Number 1. Anterior dislocation. Septal cartilage may be dislocated into one of the nasal chambers. This is better appreciated by looking at the base of the nose when patient's head is tilted backwards. Number 2. S-shaped deformity. Either in vertical or anteroposterior plan, S-shaped deformity occurs and it may cause bilateral nasal obstruction. Number 3. C-shaped deformity. Septum is deviated in a simple curve to one side. Nasal chambers on the concave side of the nasal septum will be wider and it may show compensatory hypertrophy of the turbinates. Number 4. There is septal spur, which is a shelf-like projection often found at the junction of the bone and cartilage. A spur may press on the lateral wall and give rise to the headache, It may also predispose to repeated epistaxis from the vessels stretched on its convex surface. Then we have the last or the fifth type, which is thickening of the nasal septum. It may be due to the organized hematoma or overriding of dislocated septal fragments. A question is asked in the exam that which X-ray is used to confirm the diagnosis of deviated nasal septum. Its answer is CT scan of paranasal sinuses is used, but it may be best evaluated by simple examination called fiber optic nasal endoscopy by ENT specialist. This picture is CT paranasal sinuses. Now look what is the Cottle test. Cottle test is used in nasal obstruction due to abnormality of the nasal valve. Cheek is drawn laterally while the patient breathes quietly. If airway improves on the test side, the test is positive and it indicates abnormality of the vestibular component of the nasal valve. Let's talk about the treatment of DNS. In mild cases, when there is no symptoms of DNS, there is no need for any treatment. But when the symptoms like nasal obstruction or epistaxis are present, then to get rid of these symptoms, we have two treatment options available. Number one is the septoplasty and number two is the SMR or submucous resection operation. Now the question arises that how will you decide whether SMR or septoplasty will be done, and what is the difference between SMR and septoplasty. So the difference between the two procedures is that septoplasty is a conservative approach to septal surgery. In this operation, much of the septal framework is retained, only the most deviated parts are removed. Septoplasty has now almost replaced the SMR operation. While SMR is done in adults after 17 years of age under local anesthesia, and it consists of elevating the mucoperichondrial and mucoperiosteal flaps on both sides of the septal framework by a single incision made on one side of the septum, removing the deflected parts of the bony and cartilaginous septum and then repositioning the flaps. The major advantage of septoplasty over the SMR is that septoplasty can be done below 17 years of age, while SMR is done only in adults after 17 years of age. Freed's incision is given in septoplasty, while Killian's incision is given in SMR. As septoplasty has less complications, while SMR has more complications like supratip depression, columellar recession, or flapping of the septum. That's why septoplasty is preferred. That's all about this video. Thanks for watching. Subscribe to the channel. Leave a comment below for any suggestions.